Thank you so much, Gautam. And now we'll hear from Sarah Evans-Sacco, Associate Professorial Research Fellow at the Care Policy and Evaluation Center at the London School of Economics and Political Science. She'll talk about the long-term effect of cash transfer programs on adolescents and young adults' mental health and its social determinants.
6 inches. Thanks. Yeah, so thanks so much for inviting me here today, and it's such a pleasure to be with this multidisciplinary group. So hopefully continue the interesting discussion. So I'm going to talk about these long-term impacts of cash transfer programs, and really, very briefly talk a bit about the context of poverty and youth mental health in low- and middle-income countries, which I'm sure is very familiar to the audience. And then focus on a paper we've been working on looking at closer, sorry, thanks. Looking at whether longer duration of exposure to cash transfer programs during childhood can reduce depressive symptoms in early adulthood. And then start to think about if there is a relationship, if this might be related to increased education or employment. So we know first that the majority of the world's poor are under 24 years of age, that young people living in poverty are disadvantaged across a range of both short and long-term outcomes. And this, of course, can decrease their future life chances in a very complex kind of pathway. So we know, this group knows very well about the intertwined nature of poverty and mental health. So living in poverty, these stress and circumstances can lead to increased mental health problems. And also youth with mental health problems may face more exclusion and other issues which can limit their life chances. We know that a lot of the welfare programs and cash transfer programs don't address these dynamics, but we're going to try to look at least whether there is some initial relationship. Because there is growing research, I think, linking poverty and mental health, and even we've just published a review, Zimmerman et al. In BMJ Global Health, looking at we identified 12 studies which looked at the impacts on youth mental health of cash transfer programs. And this is part of, it's part of a larger project that I've been leading called Chances 6, where we're really trying to investigate more about the dynamics between poverty, mental health, and young people's life chances by examining the potential impacts of cash transfer programs on these outcomes. And we use a very mixed methods approach with a very interdisciplinary team, looking at data across 6 countries, but focusing on 3 countries where we have collaborators. So we have several studies now looking at this relationship, but I'm going to focus on this paper here, where we look at these long-term effects of cash transfer programs on youth mental health. And so we know that, as I mentioned, we have this recent systematic review, which should suggest there is maybe some, potential small but positive impacts of cash transfer programs on youth mental health. All of the studies there looked at short-term impacts, though. And in fact, most evaluations of cash transfer programs, especially ones that look at impacts on children or adolescents, they focus much more on nutrition or education outcomes. Some of those programs do look at longer-term outcomes and at least suggest maybe increased educational attainment in longer term. There's very little known about the impact of early or sustained exposure to cash transfer programs, and especially that in relation to youth mental health. So for this study then, so we look first again at whether the longer duration of exposure to these cash transfer programs, so if they're exposed at ages 0 to 17 and looking at that cumulative exposure, whether that reduces depressive symptoms in early adulthood at ages 18 to 30. And then, thinking more just kind of exploratory analysis, really thinking about those potential pathways. And so we used data from 3 different countries with cash transfer programs, so focusing on Colombia's Familias en Acción program, and using epidemiological data in each of the countries to look at these impacts. In South Africa, we look at their child support grant, and Mexico at the Oportunidades program. And so, establishing especially the causal impact of cash transfer programs is quite challenging due to selection bias. We know recipients of cash transfer programs tend to be disadvantaged, and families tend to be disadvantaged in many ways, and in ways that are going to affect both health and other types of socioeconomic outcomes for the young people. So for this study, we really tried to exploit to address some of that selection bias. We tried to exploit some cross-country and cohort variation in the age of the children where the program was first introduced. And so we try then to capture some impact of the policy really on the cohort of individuals, of children and adolescents living in those countries during those periods, rather than just looking at the individual impacts. In terms of the treatment, so we look at the number of years of potential exposure in those cohorts from people who are living in those countries at that time. And then for the outcome variable, we focus on depressive symptoms. That was the kind of measure that we could unify across the different data sets, using different validated, where there were different validated outcomes for depressive symptoms in the 3 different data sets. And this is just to show you, it's not too small, but really suggesting, so these cash transfer programs were introduced as a national policy in all of the 3 countries at specific moment in time, at different points in time. And also there were age eligibility expansions of each of those programs at the different points. So you can see for the child support grant in South Africa, so it started out for children under 7 years. Then you can see increases to 9 years, and then goes up to 18 years. So different types of, different potential exposures for each of the cohorts. And then also this slide is to illustrate really the variation in our main length of exposure variable. So it shows the mean years of exposure for the cash transfer program for both the country and the 5-year birth cohorts. And so at least, yeah, you can see from the slide there was real variation in the exposure variable across the cohorts and countries. Okay, so what did we find? So our results really suggest that each additional year of exposure, that there was a relationship in terms of lower reduction in depressive symptoms in early adulthood. So specifically, each year of exposure was associated with 0.003 reduction, standard deviation reductions in depressive symptoms. And the mean years of potential exposure was 9.5. So that's, yeah, so in the regression analysis on the side, you can see that's for the mean years of exposure, the average reduction in depression symptoms. Now, of course, I think the last talk really talked so nicely about mechanisms. But I guess for cash transfer programs, we might consider also very complex mechanisms in terms of how cash transfer programs could impact on depressive symptoms. So in this case, cash transfer programs, especially in this, these programs are not designed to impact on mental health, especially not designed to impact on youth mental health, but that there might be some potential pathways where you could see how cash transfer programs may influence future mental health, potentially through increased school completion, which might be associated with some mental health outcomes. Employment, I think, is even more complicated. It could potentially, reduce labor market participation in the short run for adolescents who are maybe more likely to stay in school, but also potentially increase employment in the longer run for the older youth. And so at least for, so this is the more exploratory analysis, but we tried to look at whether increased education or employment might explain an association between these longer-term mental health outcomes. And so we found there was an increase in secondary school completion among those cohorts of youth who were exposed to longer duration of cash transfer programs. For employment, actually, there was a reduction in likelihood of being employed. And so at least I think our data suggests there are small impacts, but still positive impacts for these cash transfer programs and growing up during a time of cash transfer program expansion on depressive symptoms in early adulthood. And I think the effects are quite small, but they were population impacts. And given one, the programs aren't designed to target youth mental health, and also that within those countries only a fraction of the cohorts were actually exposed to the cash transfer programs. So I think this does suggest some promising impacts potentially. Right, as I mentioned, so as cash transfer programs are not targeting youth mental health, we can actually think of this maybe as a bonus or added bonus of cash transfer programs. That improvements in depression outcomes, they don't seem to be due to any improvements in employment outcomes. That improvements may be related to improvements in education outcomes, but that only would be a fraction of the explanation. It's likely to be a number of other potentially complex pathways, thinking about reductions in household stress potentially, income security, possibly through caregiver mental health, and there are at least other studies looking at cash transfer programs and their positive association with those different outcomes already. I think then if to improve mental health, I think we need better understanding and more targeting, of these programs, and also, of course, more focus on direct mental health interventions. But I think there are some, promising ways that we can think about this evidence, both in terms of, cash transfer programs. They do target this very vulnerable population already. How could we maybe and there are already some positive impacts potentially on mental health, but how could we maybe optimize those programs further and think about how we can work together, I guess in spirit of this conference, thinking about, how social protection programs could be working together more with a mental health interventions to think of how we could optimize those programs better where we already have these cohorts of vulnerable people who are identified through the cash transfer programs. Just to acknowledge all the study collaborators from the project, and to thank you for listening.
Hi. So I was just wondering if if these programs were conditional. I believe some of them are, and if you considered whether or not the conditions of the cash transfer played a role in the mechanisms, because I know you just said that we don't really think it's due to education, but I believe at least one of these, education, is one of the conditions of the transfer. And if maybe you considered like comparisons to unconditional transfers in order to get a better idea of maybe what mechanisms are at play.
No, I think that's something I think we didn't have the data to be able to explore. I think that's something, and that's a really interesting question that hasn't also addressed that well by the literature. I think there's a really interesting study by Burke Osler and Sarah Baird, which looks at those combined, where they randomize people to unconditional and conditional cash transfer programs, and where education or schooling is the condition. And there they find positive impacts on the youth mental health there also, but I think that has the best evidence. But the evidence that is out there about conditionalities usually suggests that maybe sometimes they add some stress for the young people actually, and maybe even though all the impacts are positive, they tend to be less positive for those programs where there are conditionalities. So I don't think we were able to look at it in these data, but think it's a super interesting question, and yeah, and very relevant to the mechanistic pathways.
Hi, Sarah. Thanks so much. Great paper. Could you just fill out a little bit more? How did you do your mediation analysis on the schooling?
Yeah, so I think, I mean, for this, we just really, we did it the same way that we looked at the mental health outcomes. So we just really looked at whether, if we used education as the outcome, if there was a relationship there. So yeah, it was more, kind of simple exploratory analysis.
Great. I think we're going to move to the next one so we keep time for discussion at the very end. Thank you.